All right, we'll go ahead and get started. Again, my name is Leanne Foster, and I am a Provider Outreach and Education Specialist here at WPS Government Health Administrators. And I want to welcome you all to our webinar for provider enrollment of occupational and physical therapists. Thank you again very much for taking the time to join us today, and I hope you're doing well. So I'm going to go ahead and start with our disclaimer. This is to make you aware that the material presented today and answers to questions on today's session are being answered and created based off of current Medicare rules and regulations, along with pre-submitted questions that you submitted as part of the registration process. As you all are aware, Medicare changes rules and regulations often, so please ensure that you continue to review and monitor CMS communications, which includes CMS and WPS websites for the most up-to-date CMS rules and regulations. Again, I will be answering questions based off of those as well. Also, photographing, screenshotting, and recording of this education for profit-making purposes is prohibited by CMS. As I mentioned moments ago, I am recording this session, so you wouldn't need to go ahead and do that for yourself. Also, with that recording that I am creating, that means that there will be a recording available, barring any technical issues with the recording, that will be posted to our YouTube channel and our website as an encore presentation. It'll be available on our website for approximately 90 days. It'll then continue to be available on our YouTube channel. And that's going to allow you to come back, take a look at this if there's something you missed, something you want to see again, or if you know somebody that would benefit or find this information useful, you can certainly share that with them. So moving on to our agenda for today. So today we're going to help you understand the provider enrollment process for occupational and physical therapists. While the enrollment process for occupational and physical therapists is very similar to other specialties that enroll in the Medicare program, there are some differences, specifically when they are in private practice. So in our session today, we're going to talk through the eligibility for these specialties, the basic enrollment process. We're going to talk about the differences between when they enroll to reassign versus whether or not they're in private practice. And we'll go over some really high-level coverage and coverage requirements as well and provide some resources for that. I have also included some acronyms that we'll be leveraging today. Just so you have it, Medicare loves their acronyms, so we've provided this so that that's a little bit easier for you today and that you have those at your disposal. So I want to start with just some basic coverage criteria. So coverage for occupational and physical therapist is covered in the Code of Federal Regulations, or the CFR. They are covered in Title 42, and the sections for occupational therapists is 410.59, and for physical therapists, it's 410.60. And I have included those links for you today, and I'm just going to take you out there quickly. So what you'll see here is I'm in the Code of Federal Regulations. This first one is for occupational therapists. And while we're focusing on enrollment guidelines, and that information is certainly out here as well, this does actually, the CFRs do cover the basic rules of what is covered and what Medicare will reimburse. It also covers how the services need to be provided. So if they're being provided directly or under arrangement, it covers those specific guidelines. Like I said, it also does include how to qualify as an occupational or physical therapist. It does also include here, you'll see it does include in private practice, because again, their enrollment is just a little bit different. Their provisions are slightly different. And we're going to talk through all of this today, but I wanted to make sure that you had a resource just in case you needed it. But you have that here both for occupational therapists, and then 410.60 is for physical therapists, and it's laid out very much the same way, including basic coverage requirements, enrollment requirements for both a provider that is reassigning, practicing as part of a facility, or in private practice. You have that for you today. Services for occupational and physical therapists, it does have to be medically necessary, and it has to be supported by the documentation for that service. And that includes having a written plan of treatment. That written plan of treatment is going to outline what type of therapy they're going to receive. So think modality, what's going to happen during the sessions. It's also going to speak to the amount of therapy. So how many visits are we expecting? And along with that, frequency. How often is the patient going to have this therapy? Is it going to be once a week, once a month, twice a week, 3 times a week? Whatever makes sense for the patient's condition and the treatment of that condition, that needs to be outlined. They'll also be looking for duration. Are we going to have 15-minute sessions, 30-minute sessions, whatever that happens to be? Again, that's going to vary by patient and condition, but that does need to be outlined in that plan of treatment. You're also going to want to include goals. So what are the expected outcomes of that therapy? What are the benchmarks going to be to determine if the therapy is helping the patient's condition or if adjustments need to be made to that plan of treatment? For eligibility to enroll as an OT or a PT, there are a few things we're looking for, and this is where OTs and PTs are really quite similar to other providers. We're going to need to have a license from the state in which they're practicing. So they're going to need to have an occupational therapy or a physical therapist license, and we're looking for the OT and PT license. We'll talk a little bit about occupational and physical therapy assistants later on in the session today, but one thing I am going to mention now is that they are not a specialty that's eligible to enroll and bill Medicare directly. So we're looking for fully licensed occupational and physical therapist license in order to enroll. OTs and PTs do need to have graduated from an accredited program. Now with that, typically what's happening is that the licensure bodies have this same requirement. And as MACs, we do reach out to our various jurisdictional licensure boards to identify what their licensure requirements are. And in an effort to reduce provider burden, if licensure requirements are the same as CMS enrollment requirements, that state license will suffice as proof of graduating from that accredited program. However, each state governs their licensure requirements differently. So it's not going to be a one-size-fits-all. If your OT or PT has a license, they can enroll, they meet all the requirements. I would say in our jurisdictions that is definitely largely the case. However, you may see instances where we're going to need to see a copy of that diploma just to ensure that it meets the criteria for enrollment. And generally, we're looking for, as stated, an accredited OT or PT program, or they're graduating with an occupational or physical therapy degree. Now, OTs and PTs, they can enroll a couple of different ways. They can enroll as a group member, reassigning benefits to a clinic. The clinic could be 100% a physical therapy or an occupational therapy or a combination of the two clinic, where those are the services that they rendered. You could also see an occupational or physical therapist enrolling in a medical clinic that has multiple specialties. They have MDs, DOs, nurse practitioners, physician assistants. They can reassign benefits to them. They can also enroll as an individual in private practice. So maybe they're opening up their own facility. They're practicing on their own, and they are practicing as a sole prop under their social security number only or an unincorporated tax ID. They could also incorporate, and they could be enrolling in private practice as the sole owner of their own corporation. And the big difference there is that they're practicing under an incorporated tax ID, where that tax ID represents a separate business entity from the individual. Sole proprietors, unincorporated tax ID, The real difference there is that tax ID is not seen in the eyes of CMS to be any different than the individual under their Social Security number. They can also set up groups. Now, you're going to run into situations where this might trigger a slightly different enrollment process if that group is owned 100% by occupational or physical therapists, but they can set up a group and be owners of a group. Now, the difference between this and what I just described for private practice is that in a group setting, there's more than one owner. You might have a partnership, you might have 3, 4, 5, 10 different individuals, and it may be a mixture of medical professionals and non-medical professionals that own this group. It would be set up much like a multi-specialty clinic. And in that case, they would fill out a CMS 855B. But we'll talk about those forms here in a minute. A couple of other things to note about OT and PTs is they cannot opt out of Medicare. Opt-out requirements and the specialties that are eligible for opt-out is set by CMS regulation. So an occupational or physical therapist cannot, by CMS regulations, opt out of the Medicare program and enter into private contracts with their beneficiaries in lieu of billing the Medicare program. They also cannot enroll purely for the purpose of ordering and referring, because they're typically not ordering or referring for services, and CMS has set that regulation. So an occupational therapist or a physical therapist is going to be enrolling in the Medicare program if they're billing the Part B side. We'll talk about this a little bit later. There are also facilities that would enroll on the Part A side that would bill for services. But they will not be opting out or enrolling purely to order and refer. So I'm going to start with the basic, go into the basic process. So an OT and a PT are going to follow, again, a very similar process to that of physicians and other non-physician professionals or practitioners. They're going to need to obtain a National Provider Identifier, MPI, and that is that 10-digit identifier that's used to bill claims. That is going to be assigned through the National Provider Plan and Provider Enumeration System, or MPES, and you will have to create a user ID and password to get that. And you do also have to have that 10-digit identifier, that MPI, before you submit your enrollment application. If you do not have that MPI in place when you submit that enrollment application, it will result in processing delays because we will have to develop for that information to be there in order for us to continue through the process. Once you have that, you're all set to go ahead and submit a CMS 855 application. This can be done electronically and through paper applications, and we'll talk about that just a little bit more a little later on, but it can be sent in electronically through our provider enrollment chain and ownership system, also known as PACOS, or a paper application. PACOS is the only electronic method for submitting those applications. Again, we'll talk about that just a little bit more. Once that application is received, it does go through a process, and once it successfully completes that process, which we'll talk about here in a minute, the provider will be, it'll result in the assignment of a provider transaction access number, or PTAN number. Now that's going to be the number that is going to be attached to the provider's MPI that basically contains metadata. It contains specialty information, practice location information. If the provider is reassigning benefits, it will provide enrollment information for that employer so that claims are paid appropriately and payments are sent to the correct place. At that point, once you have that PTAN, you'll still only have one MPI, and regardless of where that PT or OT is practicing, they will use that MPI to bill, but that PTAN is going to allow them to bill for multiple employers or practice setups. The application forms that will be used, again, you can submit them electronically or on paper. These are visuals of the paper application. So the applications a PT or OT would use would be the CMS 855B. Now this would be if the PT or OT is setting up a group setup where there are multiple owners, whether that is owned 100% by OTs and PTs or a combination of medical practitioners or a combination of practitioners and non-healthcare providers or non-healthcare practitioners. they will set up the 855B. That will set up the group PTAN. Additionally, they will need to do a CMS 855I for any members that will be reassigning their benefits to that group. Now that 855I is used for those reassignments, but it's also used for any OTs or PTs that are in private practice. So again, those sole proprietor or sole owner scenarios, they will fill out that CMS 855I. Even in the situation where you have someone in private practice and they're a sole owner with an incorporated tax, will be able to set up the business entity in that scenario because there's only the one owner and it is the enrolling practitioner. We will be able to set up both that business entity and that individual off of that one form. Lastly, and this is less common, the CMS 855A. This is typically for outpatient facilities that are structured to bill through the FIS system and bill Part A. We'll talk about that a little bit more. And again, these are less common. This application would enroll the facility and the individual providers would not enroll. Things would be billed on the UB04 or the 837I electronic transaction if you're filling out that 855A. Like I said, that's less common. We typically see mostly 855Is and 855Bs for PTs and OTs. So what can they do? There's a couple of different things. PTs and OTs, just like anyone else, can submit for an initial enrollment, meaning they're new to the Medicare program in its entirety, or they're new to the jurisdictional state. So a provider will submit an initial enrollment if they're practicing in Medicare for the very first time. For example, let's say they're enrolling in Michigan. If sometime down the road they decide they also want to practice in Indiana, WPS does hold the MAC contracts for both Michigan and Indiana, but because of how the claims processing system and the enrollment systems are set up, largely for contracting purposes, states will also have different requirements and different fee localities. So the states are handled separately. So in that example where providers enrolled in Michigan and then they decide to practice in Indiana, they'd have to send in a second application to initially enroll in Indiana because they were not previously enrolled there. We can't intermingle multiple states on one enrollment record for occupational and physical therapists. It's also going to be really important that the enrollment data is kept up to date. So the other thing that you will submit applications for periodically is if there's a change. Think of things like a name change, a correspondence address change, a contact change. If you are in private practice, it could be a practice location change. If you're an OT or a PT that's reassigning benefits, it could be that you're now going to work for a new employer and you're going to add a new reassignment. That's technically considered a change, not an initial enrollment. It is a change that will result in a new PTAN being assigned, but it is considered a change and is executed on that CMS 855I. The other thing that'll happen is revalidation. Once a provider is enrolled, periodically they are asked to reconfirm or revalidate all of the information that we currently have on file. This is an opportunity to make any changes that maybe haven't been reported in the interim, but it's also going to look a lot like an initial enrollment, except a PTAN is not going to be assigned. Again, this just ensures that we have all of the most current information on the enrollment record and ensures that we are avoiding any potential fraudulent situations, but that we're also paying claims correctly. And the other thing that you're going to see is deactivations. So the scenario I gave before with a change, say they're adding a new employer, they're reassigning benefits to another group, perhaps they're leaving a previous employer, or perhaps you have an OT or PT that's retiring. That would be something that would precipitate a deactivation application to terminate that PTAN. And it's really important. We will often hear, well, I'm not using it anymore, so we're just going to deactivate it for non-billing at some point. While that happens, it does leave that PTAN open for potential fraud. If someone were to get a hold of that PTAM and that MPI, they could potentially bill Medicare fraudulently. So if you have a PTAM that's no longer being used and you know it won't be used in the future, it's important to submit those deactivations and keep that enrollment data active. It's also something we'll be asking about when we do that revalidation piece. So submitting the application, as I said, there's two ways to do that. You can either do that electronically or through a paper application. And here what you're looking at, and I have included a link further down in the resources section to PACOS, but that is the provider enrollment chain and ownership system. And that is the only method with which you have to submit an electronic application. With an electronic application, it works a lot like a kind of a do-it-yourself tax software. It's going to ask you a series of questions, and it will even ask you questions specific to occupational and physical therapists. And that's going to bolt together the fragments of the application that are required to facilitate the application, the enrollment action that you're wanting to take. It's also much quicker. So with a paper application, it's still an electronic template. It's on PDF, it's on CMS's website. However, it is a template and you have to fill in all of the fields on your computer, but you can't submit it electronically. It cannot be faxed and it cannot be emailed. It will have to be downloaded and it will have to be it'll have to be sent to us regular mail. And at that point, it has to be opened, scanned in, ingested into our workflow process. The other difference here is there's automations available to us from a data entry perspective when submitted through PACOS. Also with PACOS, processing times. So processing times for an electronic application submitted through PACOS, if it is what we call a clean application that requires no development, we have everything we need, 15 calendar days to process that application from receipt to assigning a PTAM. With paper applications, the processing time can take up to 30 calendar days. With both of these, if there's development, it can extend that period of time because there is a 30-day development time allowed. However, responses are also quicker in the electronic system than they are with paper applications. So I would always encourage you to take a look at PACOS. You'd also be able to see from a revalidation perspective, you can see the information that we have finalized on your record in PACOS 24/7, 7 days a week. So PACOS is always available and you're not reliant on the mail. So once we receive that application, the process looks the same. There's just pieces of it that take a little bit longer depending on how we receive that application. So obviously the first step is submission. We receive that application and it gets into our workload system. Then we review that application to see if we have all of the information we need. Are all of the application sections completed? Which, by the way, you can't forget when you submit through PACOS. There might be incorrect information in them, but you can't miss a section. We're also looking to see if we have all the licensure. Are all the questionnaires that are needed maybe for the particular scenario completed? Ideally, we have all of that. From there, we process it and then complete the application with an enrollment decision, whether that's approved or denied, and that includes the signing of a PTAM. If there's development, this will put the application in a hold for response, which will, once we receive the information, if we receive it, it goes back up to that enrollment decision. If we don't receive a response to a development, it could result in the application being rejected. That's not the same as a denial. A rejection just means that the provider will need to resubmit the application in its entirety and start that process over. So that brings me to our first break for questions. Tom, do we have any questions in the chat?
We do. So first question, my question is related to outpatient hospitals based PT, OT, and SLP, which bill under the hospital's NPI and on a UB claim form. Should each individual therapist enroll separately?
They will not, because they're billing on the UB with the hospital's NPI. They're billing for everything as part of that facility claim. They will not need to bill or enroll on the Part B side because they are already billing on the Part A side for it. So if they're billing that way, they are all set. That would be one of those facilities that it's a little less common, but we do see them.
All right, so actually we do have another question that hopefully that answers that. So Barbara, if it doesn't, let me know. Michelle does have a question, and she's wondering that she's a critical access hospital. That's her facility specialty, and if that would make a difference. We're filling out the 855 B or 855I to have them enroll separately.
Nope, that does not make a difference. In fact, I actually no, it will not make a difference. If they want to get connected to that call though, so this is where that gets a little bit different. They would fill out an 855I to connect to the call, but they're not going to be assigned a PTAN. They would not need to set up a group on that side. It's just a matter if they're wanting to bill method 2. So if that call is billing method 1, it doesn't make a difference. They don't have to enroll separately. But if they're wanting to bill method 2, where they're essentially billing the professional services separately on the A side than part of the hospital's MPI, then they would. So it just depends on that structure.
Okay, that's our last question, but I do want to remind anyone that did ask a question, if we do need more clarification, please put that back in chat and let me know. Thanks, Leanne.
You're welcome. Thank you. All right, so now we're going to move on to the application itself. Now, as we go through this, I am going to show you comparisons. I'm going to show you paper and PACOS. So regardless of how you choose to submit the application, 1, you'll see the similarities, but 2, you'll see what you're going to see. So we're shifting to the OTs and PTs that are in private practice. Now, as I mentioned, if you have a PT or an OT that is enrolling to reassign benefits, they're going to fill out that CMS 855I just like a physician would, and they're going to complete the reassignment information in section 4F. That's going to connect them to the clinic, and they do not have to complete this questionnaire. I want to be really clear about that. We see this all the time where PTs and OTs will complete this questionnaire, and part of it is a little bit of that, if that title, it says it's for PTs and OTs, and we're all moving really fast and people are filling that out. It's probably not going to make a whole lot of sense to you if you or your practitioner is reassigning benefits. It shouldn't. So you can skip this section altogether. This questionnaire is for PTs and OTs in private practice only. So if they are enrolling for private practice. Now, if you have a provider who's trying to do the private practice and reassignment on the same application, which does occasionally happen, then they will need this. But if it's purely to reassign benefits, skip this. Save yourself some work. One other thing that I want to point out before we go through the questions, we are seeing questions come into our customer service and our provider enrollment area where they're seeing their specialty in PACOS. They reassign benefits, but they're listed as a physical therapist or occupational therapist in private practice, and that's not what they are. Unfortunately, that is a little bit of a quirk in PACOS. That PT/OT in private practice is the only PT/OT specialty, and you will select it. The question that we're getting is we're seeing change applications and questions where providers are wanting to change that back. They do not have to do that. It fees the same, it pays the same. If you're set up with private practice only and you're not, on our side, we can see whether or not you're reassigning benefits or if you're in private practice. Again, it's just a little bit of a quirk inside PACOS, and it's not anything to worry about. With PACOS 2, when that does come into play, hopefully that's going to be made much more clear. I know that's in discussions, and I've seen some things about that. It's just something we are kind of having to deal with at the moment. So here is what this questionnaire is all about. It's purely about confirming that the PT or the OT is in private practice, free of kind of governing oversight. They are completely freestanding, if you will. So the questions that they're asking, the first one, do you only render your services in patients' homes? Yes or no? That is information that we leverage when we get to section 4. We would be looking for an admin office as a practice location, but we would also understand that's not being used necessarily to provide services because that PT or OT sees patients only in homes. It also establishes that private practice. The next question is, do you maintain private office space? If the answer to that is yes, great. It is possible for a PT or OT to maintain private office space and see patients in their home. And again, this question will help us ascertain that when we get to section 4, because you have that private office space, but there would be a designation that, hey, we're going to see them in their homes as well. There's a section we'll see about that. Now, the next is, do you own, lease, or rent your office space? We need to know, again, yes or no question. And then we move on to ask about exclusivity. So we need to know if the space is exclusive for your practice, yes or no, or do you provide services outside of your offices or patients' homes? So are you maybe leasing time in another office, or sometimes in the case of physical and occupational therapies, maybe you're going to a facility that offers a pool so that there can be some aqua therapy. That would be an example of services rendered outside of that office space. So then what it says is, if you answered yes to any of the questions 2, 3, or 4, again, those are about that private space, we're asking for a copy of a written agreement that is giving you exclusive use of that space for PT and OT services. Again, we're establishing private practice. So then when you go into PACOS, you are going to need to answer the questionnaire in such a way at the beginning in order to get this question for an individual that's in private practice. So what you're seeing here is the Part B non-physician physician specialties drop-down list in PACOS. And this is where you're going to see what I had mentioned as a quirk. This is also the only specialty for occupational or physical therapist. So regardless, it's going to look like you're enrolling for private practice. However, when you are indeed practicing private practice, you have to select these specialties in order to activate the questionnaire that we just talked about on the paper. Okay. If you select this specialty and then you tell the system that you're reassigning benefits, you will not be required to fill out the questionnaire. It will be there, but it will not be a required section that will prevent you from submitting the application. And we think that that might be where people are getting the impression they have to fill it out. It's there. PACOS is only supposed to give you the topics that are there. Look for little red asterisks. There's a red asterisk if you're truly in private practice based on how you answered the questionnaire. That asterisk goes away if you say you're reassigning benefits only. It's really subtle and not very prominent. So we totally understand that. But again, it's not required for group members, only private practice. And this is what the specialty questionnaire is going to look like in PACOS. So when you get to the practitioner specialty, this is after the questionnaire when you're going through the topics in PACOS, you will go in and your specialty is there. And then specialty questionnaire, in this case, it's required. This screenshot was created without that doing a reassignment piece. So it's just going to be a matter of selecting that add button, and it will then give you the same questions that you see on the paper application, which is represented by the image you see here on the left. And how you answer those may trigger the request for a copy of that agreement at the end that's showing that exclusive use. So if you have a group, it's very much the same way, but I wanted to show you what this looks like when you're doing it for a supplier of services. And again, this is going to be on the Part B side, not the A side. This is to set up a PT-OT group. And setting up a PT-OT only group is typically going to be because the ownership is 100% physical and occupational therapists. Usually all of the entities inside, or excuse me, all of the practitioners inside of that group are OTs or PTs as well. It can be just OT, just PT, or some combination. And they may have SLPs in there as well. but we're setting that up. So with that same thing, it's going to activate that specialty questionnaire, and it's not going to be required on the members of this group when they submit their applications. The questionnaire on the group, this is what the paper questionnaire looks like, and it's really the same questionnaire. It's asking the same questions, except the verbiage is changed just a little bit, okay? So it is, again, as I said, it's based on those ownerships, and there could be a combination of members inside of that group as far as specialty goes. We're looking at being 100% owned by PTs and OTs. And on the B, it's going to be in section 2D. I did include a link to the form for both the I and the B, but it's section 2D. It's just in a slightly different place. But again, establishing the same information. And here you'll see the questionnaire in PACOS. Again, very similar to what you're going to see for the individual. And again, it will only trigger when you select that appropriate specialty. And it's not something that can be changed once the questionnaire is completed. That questionnaire is about creating that application. And once you get past that point, if you had selected the wrong specialty, it would be something that you'd actually need to delete that application and start over. And I say application, not enrollment. If you have a provider that's established, that is already set up, and not something that can necessarily be changed. So I want to talk about some of the other forms that an OT or PT may need to complete. Now, this first one is optional. It's a CMS 460, and this would be for the groups or Part B organizations, Part B groups, not on the Part A side. It would be for sole proprietors or sole owners to accept Medicare payment as payment in full. They do get a slightly higher allowable amount, and we will pass their claims on to the Medigap insurance for them. But this is something that does need to be elected. It's participation is not just based on filling out that CMS 855, so this is an option. And typically, if it doesn't come in with the application, we will ask just to ensure, because it's also not something that can be changed at any time. There is a little bit of a grace period after an initial enrollment. Otherwise, it does need to wait till the end of each year, which is our open enrollment for providers to change their participation status. So that would be something that would need to be included. In PACOS, it is not part of the interface. It is a form that would need to be completed and then uploaded as a document for that submission. Next to this is the CMS 588. Again, this is going to be for your OTs, PTs in private practice and those groups that are being set up. In both cases, the 460 and the 588 do not need to be completed on group members, because those group members are going to follow suit with how that group or organization was set up. So this establishes the electronic payments. It is required. Medicare does not issue paper checks unless they were grandfathered in before the creation of the CMS 588, which Revalidation has really cleaned all of that up. Nobody should be receiving paper checks. And it needs to be submitted for a new enrollment, or if there's account information changes. So the bank changed, the account number changed, whether you changed banks or not, and that account number changed. This is how you would report those changes. In PACOS, this is actually a section, it's a topic, and can be completed that way versus completing that paper form. With that, we do need to have some account verification documentation. So we're verifying the name of the bank, the name that is the owner of the account number, the routing number. So acceptable forms of that account documentation include a voided check. The key here is that it's not a starter check. We're not looking for a particular bank number, but it can't be a starter check where you handwrite the check number or handwrite the account holder information on the check. That's not acceptable. In lieu of a voided check, though, we will accept a signed letter from the financial institution Doesn't necessarily have to be from your branch, doesn't necessarily need to be from the president of the bank. A teller at any branch that is able to verify your account information can complete that letter, and that can be submitted. We're also typically looking for that letter to be no older than 1 year to be considered current. Just want to recap the supporting documents that you may need to submit with PTs and OTs. We talked about the license. So they need to be licensed in the state in which they're practicing as either a physical therapist or an occupational therapist. And they may need to provide proof of the education. Just depends on the state licensure board, and we will develop if we need it. But I can tell you for our jurisdictions, most of the time, that license is going to suffice for that. The next thing that we may need, and this is going to be for those groups and those providers in private practice, IRS tax identification verification in the form of typically a CP 575, a 147C, if there's some type of nonprofit tax ID involved, the statement of your 501c3 status or your nonprofit status, but it has to be something that's computer generated from the IRS computer. This is something that helps us ensure that we have the correct legal name in our system that matches the IRS system, and it just helps us avoid any mismatches when the IRS and CMS audit these later on. That could potentially impact billing for the provider. We'll also ask for any adverse legal actions if needed. So typically this is addressed in Section 3 of all of the 855 applications, asking whether or not the enrolling provider has any adverse legal actions. Having them doesn't necessarily preclude a provider from enrolling, but if they have them, we do need to know when the action was taken, who it was taken by, if there was a resolution, what was that resolution, and then we're looking for documentation of that, and it would be like court documents that are outlining that action. I do want to keep in mind this is not an inclusive list, but for PTs and OTs, it is largely what you're going to be asked most of the time. Stating it's not an inclusive list is just really depending on the individual situation. We may ask for more information. The other thing that I would add to this list is the agreement if you have exclusive use of your office space. We're going to be looking for a copy of that as well. And that agreement does need to have a clause in there outlining that exclusivity. PTs and OTs are going to be, PTs are going to be subject to a site visit. This is outlined in the Program Integrity Manual, Chapter 10, and it is Section 10.6.15, which is for risk-based screening. So this is for initial PTs only. It is not something that applies to OTs. And it is if you are an individual reassigning benefits and you're joining a group, but you are brand new, if that PT is in private practice, or if we're setting a group with PT or OT only owners. That site visit is looking for the operational status of that site. It's entirely possible that you'll never interact with the inspector. They're looking to see, is there signage? Is there a sign of business? Is it open? Does the location exist? We do have instances where we've gone and it's a vacant lot or it's a locked building with no sign of business. These are the things that we're looking for. If the PT is setting up, say, in a storefront, say in a multi-use building, or maybe it's a strip mall, we're just looking to see what that setup is, and that is a CMS requirement. If that PT is rendering services only in patients' homes, the site visit requirement is not necessary because they do not have an office space where they're providing those services. You will get notification if you are eligible for that site visit. A letter does go out just letting you know what's going to happen and be prepared for it. I will tell you though that those site visits are not scheduled or planned. So if you have unusual office hours or there's something inspectors need to know about accessing the facility, if they need to get to your office door, just make sure you include that somewhere with the application, just to kind of streamline that. That includes office hours. We won't send it, the inspector won't be sent out during non-office hours. Again, we want to give the best probability that that site's going to be operational and open for business for those inspections to go smoothly. I do also want to talk a little bit about therapy assistants. Physical therapy assistants and occupational therapy assistants are not eligible to enroll in Medicare. And I've provided a link here, and I'm going to take you out to that resource, but to an article that is on our, I'm searching for this, out on our website, and again, that link is in there. Therapy assistants, what they cannot do. This is going to give you a reference to a manual reference as far as regulations is what they can do. But essentially what a PTA and an OTA can do is they can assist in carrying out that plan of care. What they can't do is they do the initial evaluation independently. They can't develop that initial plan of care. They're not going to do the reevaluations. Everything that they are going to do is going to be under the supervision of the primary therapist. So they're not going to bill separately for their services. And just make sure everybody's aware of that and where they can find that information. Briefly, before we get to some resources and another question segment, I do want to talk about facilities. We mentioned this a little bit earlier with the questions that came in. Fantastic questions. So facilities can enroll for physical therapists, but they're typically enrolling on that CMS 855A. And as was mentioned in that question, they're billing underneath that hospital's NPI and not independently. That is something that can happen. It's typically for comprehensive outpatient rehab facilities or inpatient rehabilitation facilities. And in this case, they are not enrolling their professionals separately because they are coming in as part of that facility on that UB04 or that 837I transaction. So I just want to leave you with some, before checking for questions, some resources. I did provide the resources from the Program Integrity Manual or Chapter 10 for provider enrollment that goes through both the OTs and the PTs, but then also resources for the CORFs and for those inpatient rehab facilities. So that information is there. I did also include some high-level CMS resources just about provider enrollment in general that will also include things for changes and for revalidations so that you have that. From a WPS perspective, I did include a link to our provider enrollment guides and resources page, along with that reference for PT and OT assistance, and again, some information that we have on our website for that inpatient rehab facility and the benefits for them. And the last slide for resources, I did include some system resources for you, encouraging the use of PACOS, especially as PACOS 2.0 starts getting closer to its implementation process. Setting up for PACOS now is really going to help make that more smoothly, and there's a lot of enhancements going into PACOS 2 that should make utilizing the electronic system a lot easier, but there are going to be things from this system, the current system, that are going to make that newer system more familiar as well, because some things are going to remain the same, just be enhanced. So with that, I am going to check in with Tom. Tom, do we have any questions?
I do have one question right now, and it's referring back to when we talked about groups. Questions for PT/OT reassigning to a non-PT group. In Section 2 of the application 855I, the only option for the PT or OT shows those in private practice, but no option for those who are not in private practice. You mentioned in PICOS that you mentioned in PICOS that this is one of the quirks. But is this also true then for the 855I?
It is. Unfortunately, it is. It's something that has been brought to CMS's attention. They don't seem to have the intent to change that, but it would be the same. Private practice is still an OTPT. And when we look at the question and we're looking for that questionnaire and we're looking for that reassignment section, that's what's helping us define, do we need that questionnaire or don't we need that questionnaire? So if you'll still say the in private practice, but if they're reassigning benefits, you can still skip that questionnaire.
Okay, that was the only question we got.
All right. Thank you, Tom.
Oh, sorry, Leanne, got one more.
Yep, I saw that.
Just to clarify, for a PT group and LLC owned 100% by a PT, do we use the 855B or the 855I when doing a new PT as part of our group? And will they be reassigning their benefits to us?
Okay. Excellent question. I'm going to unpack that a couple of different ways. So it depends on how many owners there are. So if it's an LLC that's 100% owned by the one PT, when that owner PT submits their application, they're going to submit the application on the I because that's considered a sole owner. And we can set up their LLC and themselves as a practitioner all from the 855I. That 855I allows that. Now, when you add a new PT to join that LLC, they are going to need to do their own 855I application to reassign to that LLC. If you have an LLC that is 100% PT owned, but there's multiple owners, that is the scenario where they'd have to do an 855B. So for this, it really just comes down to how many owners are there to that LLC. But if it's only the one and they are also a practitioner, they can do that 855I.
All right, that really is all we have.
Okay. So before we wrap up, I do want to let you all know about something that is pretty exciting news. CMS is going to be hosting an in-person National Provider Enrollment Conference. They are hosting this to help educate the provider community and the things that they're going to cover. We're hoping to see something about PACOS 2.0. That's not set in stone just yet, but they will be offering some Provider Enrollment 101 type classes. They're also going to be talking about upcoming regulation changes. So that's pretty exciting. And it's your opportunity to really interact with CMS. You'll also have MAC representatives from all MACs participating in that, and they'll be available. That is occurring in August. It's happening August 28th and August 29th in San Diego, California. And the times vary by day and the sessions vary by day. So I have included that link at the bottom for you to see what's there, see if anything piques your interest, and for you to register. I do want to point out this is a free conference. There is no charge to attend the conference. You obviously would be on your own for lodging and travel arrangements. However, the conference itself is at no cost to the provider community. So it's a really exciting opportunity to get to interact with CMS, hear about some of the things that are coming up. So I encourage you to take a look at that. So with that, that ends the presentation today. On behalf of myself, Tom, and everyone on the WPS-GHA Provider Enrollment team, I would like to thank you very much for taking the time to attend today. We look forward to your survey comments and any suggestions that you may have for upcoming educational events. Again, I would like to thank everyone for attending today and hope you continue to stay well. Thank you, and you may now disconnect.